Well, good morning. It's great to be here talking about our progress and challenges in global health and new initiatives to accelerate this work. I especially want to recognize Prime Minister Kishida and the government of Japan for bringing the G7 nations and so many public and private funders together behind two powerful efforts. First, III for global health, and second, the MCM Delivery Partnership for Equitable Access. We do need increased investment in global health. Between 2000 and 2015, global health made incredible progress by every measure. Key statistics like the number of children dying under 5 were cut in half, fully achieving the Millennium Development Goals. So following on from that, the Sustainable Development Goals, driven by the United Nations, set an ambitious target to cut childhood death in half again. Well, as you know, a variety of challenges emerged that we hadn't expected, starting with the pandemic, but war, economic conditions, lack of stability in some locations, and so it's been a big challenge. And since 2015, our progress on health metrics has largely plateaued. And so if we step out and say, okay, how do we get back on track? We see that we need both upstream innovation and new products, and then we need downstream innovation in our delivery systems, including the ability to finance those systems. If we just look at one disease, malaria, we need cheap diagnostics, cheap bed nets, and the bed nets can never stay the same because we get insecticide resistance. So now the first generation of nets is moving over to a dual insecticide approach, and that was a challenge in terms of the price. But now with volume commitments, we're able to get that price down, and we have many new generation of nets coming along. We need a vaccine, a third generation vaccine that has significant duration. Across all of our diseases, we need these tools. They have to be very effective and very inexpensive. And so the spirit of III, where we engage the private sector, is critical to this future progress. Of course, that includes the pharmaceutical industry, and Japan has had a very pioneering effort called GHEC that draws in the manufacturers to apply their incredible expertise to the greatest needs in infectious diseases in developing countries. For pandemics, we need new tools. Things like environmental surveillance needs to be done on a constant basis so we're never caught off guard again. The ability to make diagnostics, literally billions of diagnostics in a few months that can be very cheap and very accurate, that's absolutely necessary to avoid the difficulties of the next pandemic. We need a worldwide network of vaccine manufacturing capacity. And there have been recent advances funded by the Foundation and others to allow us to have mRNA vaccine factories at various levels of capacity at a very low cost and able to make low cost vaccines. And so as we pull all of this together, the surveillance, the global health core, the diagnostics, the antibody capacities, a variety of things, if we're faced with a pathogen like COVID, we will do dramatically better. In fact, every country should do better than even the very best countries did. Global health has a huge impact on countries. The human development of not only avoiding deaths, but also solving malnutrition problems gives you your basic human capital that allows your country to move forward. So we have to rededicate ourselves to regaining progress, to achieve ambitious goals like the eradication of polio, and make sure this preparedness is available everywhere. So thank you to everybody engaged in III. It's going to be a new tool that will help us accelerate work in this incredible cause. Thank you.